This is Ginny Brant with Unleash Your God-Given Healing. Today, we're going to look at a very important topic, dense breast as a risk factor for breast cancer. I have to be honest with you, it puzzled me that I was diagnosed with an aggressive breast cancer for which I had no genetics nor any risk factors. Any known risk factors, let's say, at that time. In addition, 3 mammograms missed my breast cancer. Ironically, in the past few years, 3 well-known and respected cancer entities, the American Cancer Society, the National Institutes of Health, NIH, and breastcancer.org, have all added dense breast as a risk factor for breast cancers. This was after my diagnosis. Now, this is significant because I have dense breast. And today we're going to look at what these well-known breast cancer entities have to say about dense breast. What is it that you need to know? Number 1, let's look at the American Cancer Society and what they have to say about having dense breast tissue. They say that breasts are made up of fatty tissue, fibrous tissue, and glandular tissue. And breasts appear denser on a mammogram when they have more glandular and fibrous tissue and less fatty tissue. Women with dense breasts on mammograms, they say, have a risk of breast cancer that is 1.5 to 2 times that of women with average breast density. Something we need to realize. Unfortunately, though, dense breast tissue can also make it harder to see cancers on mammograms. Let me explain. Dense tissue appears whitish on a scan, and so do cancer tumors. So white on white is hard to see. A number of factors can affect breast density, such as age, menopausal status, the use of certain drugs, including menopausal hormone therapy, pregnancy, and, of course, genetics. Now let's look at information from the well-respected National Institutes of Health, or the NIH, regarding dense breast. They say breasts contain glandular, connective, and fat tissue. Breast density is a term that describes the relative amount of these different types of breast tissue as seen on a mammogram. Dense breasts have relatively high amounts of glandular tissue and fibrous connective tissue, and relatively low amounts of fatty breast tissue, which matches pretty much with what the American Cancer Society, the ACS, said. How do you know if you have dense breast? According to the NIH, only a mammogram can show if a woman has dense breast. Dense breast tissue cannot be felt in a clinical breast exam or in a breast self-exam either. For this reason, dense breasts are sometimes referred to as mammographical dense breast. So you might ask, how common are these dense breasts? Well, according to the NIH, nearly half, or 50%, of all women age 40 and older who get mammograms are found to have dense breast. The NIH agrees with the ACS in that they say breast density is often inherited, but other factors can influence it. Factors associated with lower breast density include increasing age, having children, using tamoxifen, using postmenopausal hormone replacement therapy, and having a low body mass index. Interesting, huh? The NIH also gives us the categories of breast density, which is important to know. Doctors use the breast imaging reporting and data system called BI-RADS to group different types of breast density. This system, developed by the American College of Radiology, helps doctors and radiologists to interpret and report back mammogram findings. Doctors who review mammograms, of course, are called radiologists. And BI-RADS classifies breast density into 4 categories, from less dense to more dense, as follows. A, almost entirely fatty breast tissue, which is found in about 10% of women. And then there's B, scattered areas of dense glandular tissue and fibrous connective tissue. And this is found in about 40% of women. So in these 2 categories, mammograms are simply more reliable. And as we just learned, 50% of all women are in these last 2 categories. So let's look at those. All right, there's C, heterogeneously dense breast tissue with many areas of glandular tissue and fibrous connective tissue, and found in about 40% of women. And then last but not least, D, extremely dense breast tissue, which is found in about 10% of women. So if you were told that you have dense breast, it means that you have either heterogeneously dense or extremely dense breast. Only a radiologist can tell you this information, and many states are now requiring radiologists to inform their patients if they have dense breast. Wish I had known. I also think it's best to find out exactly which category you are. So next time you get a mammogram, be proactive and ask for this information. Now let's look at information from breastcancer.org, what they say about dense breast. They say that research has shown that dense breasts can be twice as likely to develop cancer as non-dense breasts, and can make it harder for mammograms to detect breast cancer. So I think all 3 entities agree on this. And according to breastcancer.org, knowing whether you have dense breast is important for these reasons. Number 1, dense breast, as we've mentioned, makes it harder for doctors to see breast cancers on mammograms. And this increases the risk that cancers might, as in my case, be missed. And number 2, women with dense breast have a higher risk of developing breast cancer as compared to women who don't have dense breast. The greater the amount of dense breast tissue, the higher the risk. However, you don't necessarily have a high risk of breast cancer just because you have dense breast. According to breastcancer.org, breast density has to be considered along with other risk factors, such as age, family history, and any history of breast biopsies showing atypical cells or other changes that increase cancer risk. Breast density is just one piece of the puzzle in thinking about your breast health and breast cancer screening plan. 3 is a charm, and we've just heard from 3 respected entities. Next time you get your mammogram, ask your radiologist if you have dense breast tissues. And if you do, there are 3 things you can do. Do monthly self-examinations, because these will be very important because I found my breast cancer tumor when missed by 3 mammograms. Number 2, you should demand the newer 3D mammogram if not offered. And number 3, occasionally doing an MRI, thermogram, or ultrasound is a good idea. I hope this information has been helpful to you. I certainly wish I had known this before I was diagnosed with breast cancer. I depended on those mammograms to protect me, and I was very much let down when they missed my cancer 3 years in a row. Early detection is key. If I had been diagnosed 3 years earlier, I might not have had to been prescribed chemotherapy, and what a difference that would have made. So I certainly hope this is helpful information for you as you put your breast cancer plan and detection methods in place. Like this video, share it, subscribe to my YouTube channel, and click that notification bell so you will know when I post new information. Until next time, here's to your breast health and preventing breast cancer in the first place. And may God bless.